Something happened this past weekend, but in 9 months, she had never been to the clinic, and she's only going now that she's in labor. And this was a breached birth. Breached birth meaning that the baby, instead of coming head first, comes feet first. This is very dangerous. And hi guys, something happened this past weekend, and it just had me thinking about how people approach health, right? So my wife's aunt is a professional nurse and she works in a rural clinic. Now, a woman approached the clinic at night, this woman was there because she had to deliver, so she had labor pains and that sort of thing, right? So as they try to prepare her and they first imagine that she probably has warts on the on a closer look, they can see that no, it's actually the baby's toes. This lady was presenting to the clinic for the first time ever. So she lives within so many minutes, so many kilometers from the clinic, but in 9 months she had never been to the clinic, and she's only going now that she's in labor. And this was a breached birth. Breached birth meaning that the baby, instead of coming head first, comes feet first. This is very dangerous, and it's not a dangerous pregnancy. It's usually a very dangerous labor process. So when the baby is being born, the umbilical cord can get wrapped around the neck of the baby and suffocate the baby. As the baby comes, the baby can get trapped in the birth canal. As you can imagine, when that is happening, the baby can, the brain of the baby can be oxygen deficient, and this can cause neurological damage. So the baby can die, or the baby right enough will be born, but will have some kind of neurological damage, and they might have then developmental problems, be it speech, hearing, cognitive disorders. Umntana wam Luanda is not performing well at school, right? Now we say that the baby has other things. There's autism, there's this, there's that, right? And I felt very angry when I heard about this, because it just doesn't seem to stop. The ignorance from people is, and I'll call it that, right? There are many reasons for you, and you might want to say that it's not ignorance. I just don't know why someone would not go to a clinic that is within reach to them for 9 months. It's just very unfair. It's unfair that patients stay at home for a long time. And I get that there are situations where it's not the patient's fault. It's not the patient's fault that they stayed at home and didn't present sooner. But as a healthcare professional, whether you're a pharmacist, you're a nurse, you're a doctor, physiotherapist, occupational therapist, you really want to have an easy job yourself. Yes, you can deal with complicated problems, but we don't need to, because the things that are complicated are things that actually can be avoided, right? So if we, unfortunately, health facilities seem still to be the last place that people go to. And that's really not ideal. On this case that we are talking about, there's plenty of them. And what usually happens then is the person blames the healthcare workers to say that you guys are the reason that my baby was born this way. And they will go to that district or the provincial department or at national, and they will then, go there with a lawyer. And there's something called medico-legal claims, or we call them MLCs. The lawyer goes and approaches the Department of Health and says, I am representing client A. My client has this baby, and the baby now has some form of deformity. This means that my client will have some difficulty raising this child. This child will be a special needs. It'll cost so much to take the child to school. My client most likely doesn't have to work or has to get someone to help with the baby. This is how much this will cost. This baby is estimated to live for another 20 years, will never be able to get a job, etc., etc., etc. And then this is then quantified into an amount, a rand value. So that's one case, and then there's another case, and the third, and the fourth, and the fifth. Are there medico-legal claims that are fair? Where there was ignorance from the side of the staff? 100%. Yes, there are. But it is my opinion that we can do something about these kind of cases where this could have been avoided. So we speak of something called quality of life. And this child, even though the child can be alive and there can be millions of rands paid out, this child will have a poor quality of life. This is a human being. This is a human being who would have had dreams and aspirations of becoming something in life. But again, I will blame the mother and say, because my mom did not go to the clinic on time, right? Because you should have presented to the clinic within 20 days. Certain tests need to be done. Are you HIV positive? Are you not? Can we prevent the baby from getting HIV from you through the Prevention of Mother to Child program? Can we detect anything else in the pregnancy? Then we can advise you to terminate the pregnancy beforehand. Is there anything else that we could have seen that we can help with? Oh yeah, so the baby is breached, so we can then send you to a tertiary facility, which is a hospital, and then you can get a C-section to be done, cesarean section, instead of having a normal vaginal delivery or NVD, right? The question has been asked, but for me personally, the even bigger issue is that this is a human being who could have contributed to society. How? So you could have become another Elon Musk. You could have become another Einstein. You could have become another great mind that could have helped us with technology, with health, engineering, with the music, arts, sports, you name it, right? Because a person has that contribution towards our community, and we could be taking away someone who's going to be a teacher of philosophy, a teacher of mathematics or other. We could be taking away someone who would have been a great political leader, or someone would have been a leader at university level and change the curriculum there, right? So the more claims that the Department of Health gets, the less money is available to buy medicine, the less money is available to employ doctors, the less money is available to employ pharmacists. And there's this then ripple effect. And this is why I am very passionate about patient education, about health promotion, and about preventing disease in general, right? Because if we can have a lot more people, a lot less people becoming sick, then we can save a lot of money as a country. If we say that a woman of this age and is sexually active should do a pap smear every 3 years or 10 years, then we pick up the cancer before it becomes complicated. Because when it's complicated, it's going to take a more sophisticated approach to treat, and that costs more money. If we say to men they must do a prostate exam every year, then again we catch it beforehand. If we say you must go to the dentist every year, again here we can catch whatever's wrong beforehand. And I just want to encourage this and promote it to everyone that is listening. This helps society that much more. It doesn't just help you. If you can learn to look at health in that way, I think would make a very big difference, because the budget currently is bleeding. It's bleeding because of medico-legal claims. It's bleeding because of more and more sophisticated cases that hospitals have to treat. And for me, the sad part is that most of these are things that could have been avoided. So let's please choose better. Let's please educate ourselves. If you have a smartphone, you have the internet, you have internet access, right? My name is Rwanda Mkachane. I am available on all social platforms as @AskRwanda, and I'm always willing to advise and listen should you have a problem. Keep well.